Good afternoon and welcome all to today's webinar about protecting our region's children from gun violence. We are thrilled to have so many of you joining us on this rainy day in Pittsburgh, which feels like a good day to dig deep around community learning. I want to start by recognizing the generosity and dedication of each of you, our donor family. Your commitment to partnering with us to build a safer, healthier Pittsburgh is at the core of what we do at the Pittsburgh Foundation, and I'm deeply grateful for your collaboration, as are our grantees. Today's discussion is centered on an issue that touches each of us: gun violence. For the third straight year, the Centers for Disease Control and Prevention reported that gun violence is the primary cause of death for children under 17. This, in our country, one of the most economically advanced and considered one of the most civilized, should be a shocking wake-up call. We are in the midst of a public health crisis. It permeates every corner of our community, and it is leaving a profound and lasting impact on families, schools, and workplaces. For us, the wake-up call was the tragic massacre of elementary school children in Uvalde, Texas in 2022. As many of you know, the Pittsburgh Foundation, the University of Pittsburgh Institute of Politics, and the United Way then joined forces over the last 18 months to produce a series of forums. We produced a final report on those forums to enhance our community's understanding of the issue and better position us to respond to this societal challenge. The report is eye-opening and challenging. It underscores the urgent need for community-wide action. It was not about collecting statistics. It was about creating a roadmap. And it is an invitation for all of us to step up our work together in community for the physical safety and emotional well-being of our children. Today's webinar is one of the next steps to engage in knowledge building and partnership so that we can reach better solutions and strategies to overcome this public health crisis. The children in our region cannot thrive or reach their full potential if they face threats and are not safe. Neither can their parents or other family members, teachers, and mentors. The Pittsburgh Foundation is deeply rooted in our region's communities, and we have a responsibility to address the critical issues that affect our collective well-being, especially those, like gun violence, that disproportionately impact the most vulnerable among us. If we're to live up to our mission to improve quality of life for all residents, then addressing gun violence prevention is not optional. It is essential. I consider it our most important set of responsibilities to uplift, to invest in, and to stand alongside those who are on the front lines of the movement to end gun violence. I'm hopeful that together we can create a Pittsburgh where every resident feels safe, valued, and free to reach their full potential. So we thank you again for your support and for joining us today in this critical effort. And now I am honored to introduce our heroic Vice President of Donors and Development Services, Lindsay Aresti, to share the program with you. Thank you for coming.
Thanks, Lisa. Hi, everybody. I'm Lindsay Aresti, Vice President of Development and Donor Services. I'm glad to be here today. I have one not so fun job and then one very fun job. The first is some basic housekeeping about the not so fun job, is some basic housekeeping about today's webinar. There is captioning available for those that would like to use it. If you like to enable the caption feed, use the closed caption button at the bottom of the desktop app or in the settings section if you're viewing from a mobile device. Also, today's presentation, this is like the #1 question when it comes to webinars, is being recorded. We will share it out on the Foundation's YouTube channel. We will also pass it around to the folks attending so they can pass it to to others that might want to learn from today's webinar. And I will be facilitating a question and answer at the end of today's webinar. So anytime throughout the webinar, you can go down to the Q&A section and list any questions that you might have, and we will come to them at the end. And now for my fun job. So there are people in your career that you come into work every day to see. And one of those people for me is Dr. Michael Jonas. He is our Vice President for Community Partnerships and Learning and has been at the foundation for 10 years. He has a plethora of experience inside and outside of the foundation that make him the perfect person to discuss today's topic. But also, Michael has an amazing life outside of the Pittsburgh Foundation. If there is a thing in this world, if any of us could do, it is to try to do the amount of things that Michael does. He is an adjunct faculty at GISPIA. He is an emergency medical technician. He is an artist with features all over the city, and he is also a volunteer firefighter. So can we just add the amount of things that make Michael the amazing person that he is? We've had the pleasure of working together for 10 years, and I'm blessed every day to call him my colleague. So with that said, I will pass to the amazing Dr. Michael Jonas.
I mean, Lindsay, I don't know.
I can't help myself. I'm sorry.
Yeah, that was, so thank you. It's really wonderful to be with you all. It is truly a privilege to be with you, to talk to and share with you about this information. Lindsay, thank you. And Lisa, for your leadership and supporting this work in our leadership in really an emergent area of practice. I serve as the Vice President of Community Partnerships and Learning at the Pittsburgh Foundation, and I'm just privileged to work with everyone here to really respond in the most highest capacity and level with most compassion to things in our region that we need and should be responding to. And if you go to, and Katie Balonis is 394-2612 is my office number. We need to change that and make sure you have all my correct information that we'll send out in a follow-up email. Katie, if you could go to the next slide. So I'm really privileged to share with you some information about a really important series led by the leadership here, Lisa at the Pittsburgh Foundation, the United Way, and also Institute of Politics in response to the public health urgency and emergency associated with young people experiencing and exposed to gun violence in our country. Today, we're going to be talking about, I'm going to provide some information with you for you about gun violence statistics and information in our region to help us calibrate and come to a common understanding. Please do use the question and answer space. It's really awkward for me. I feel like I'm back in a lecture setting and to not have some back and forth, but please use that space and let's talk more and write your questions down throughout the sessions. We're going to go over a quick overview of the 3-part series of forums that we helped facilitate and coordinate that enabled a lot of learning in this space, and then also provide some recommendations that came from our report, as well as introduce you to some organizations that are doing some really wonderful work that we support, that we work very closely with this area related to primary, secondary, and tertiary public health prevention levels. In talking with Lisa and Lindsay earlier, wanted to make sure to share with you why I'm in this space and why I've gotten involved. And you can go to the next slide as we get started, is because I'd say early 1990, I guess I'll just share with you, I was interested in going to medical school. I was applying to medical school, and I'm the product of, son of a doctor and the product of some really wonderful privilege and opportunities. And through a series of events, including a big art exhibit, I ended up being in helping to run an after-school program in Washington, D.C., in Northwest D.C., about a mile north of Howard University off of Georgia Avenue. So I came there to help run an after-school program. I was needing to make some money and was applying to medical school, and ended up landing in this program called Kids House that served about 63 kids, 65 kids in the basement of 612 Morton Street, just north again of Howard University. It wasn't within 2 or 3 days of my time there that a shooting occurred. And then shootings were occurring every single day. Kids were having to walk around the development because they were afraid to walk through the corridor in the middle because of how much gun violence related to the peak of the epidemic of crack cocaine selling and transaction in this country that occurred in the mid-90s, when violence really hit its peak in general overall. I'd say from that experience, it shaped my realization in the world of of privilege and opportunity. I fell in love with the people and community I was with and realized that the world I grew up in was totally different from where they were living. And I spent 10 years running a kid's house to my parents' real disappointment and my lack of transparency. I did not go to medical school. I sort of dragged that out a little bit. Ended up at that time, ended up getting a master's and doctorate in public health, focusing on social drivers of health, like violence, like housing instability, like factors in the community and air quality that affect cancer, other factors like that too. So it's that experience and being having the great privilege of working somewhere as wonderful as the Pittsburgh Foundation that supports these both direct engagement and direct needs and basic needs type support while also looking at these system level issues. So I'm going to share with you some background around gun violence trends in our region. I do want to stress what Lindsay said earlier is that this information may be triggering for some of you if you've had any exposure yourself. I would just encourage you to please take some time if you need to turn your screen off or take a minute to yourself. If you're overwhelmed or if you need anything, please let us know. But just want to let you know we are going to cover some difficult topics. Next slide. So just wanted to share with you that homicide in our region is affected by a variety of factors. It's deeply concentrated in Allegheny County by geography, demography, and socially. And there are a variety of risk factors, including cultural, community, and relational factors in our region that affect gun violence outcomes. For the state of Pennsylvania, as you see here on this slide, this is from the Johns Hopkins Center for Gun Violence Solutions in 2022 showed that there were 48,204 deaths related to firearms in the United States. 27 of those were people who died by firearms suicide. This is often very little discussed, but is the number one cause of death associated with firearms. In addition, 19,651 died by firearm homicide, 463 died by unintentional gun injury, and an estimated 643 in the country were fatally shot by law enforcement. In addition to an average of more than 200 Americans that visit the emergency department for non-fatal injuries every day, these shots are not just the outcome of impact is not just about the physical injury that occurs, but it's the many experiences that violence impact people living in communities with high levels of violence, losing a loved one from firearm homicide or violence, or being threatened by a firearm, or just fearful of walking outside, knowing that that occurred. And that has rippling effects that one of our forum series is going to talk, I'll share a little bit more about as well. This impact, though, has an impact on everyone in our country in many ways in which we think is the young people in those specific geographic areas in our region that are affected are our children too. So how do we think about, as Lisa noted, creating a space and a setting where everyone has the opportunity to not just survive, but really thrive? Next slide. Just wanted to provide some grounding of where Allegheny County lies in relation to the city of Pittsburgh in the United States with data from 2010 to 2020. And you see that the city of Pittsburgh has a higher level, almost 3 times that in general, in some areas, about 5 times that for the United States. But the city of Pittsburgh falls in the middle to the lower third of equal sized cities across the country, balancing out in terms of we're about less than half of Detroit, Baltimore, or St. Louis by comparison, and we're about 2 times that of Seattle, Austin, Texas, and Boston. So just to kind of couch where we are a city, though have many neighborhood-specific intervention opportunities because of the hyper-geographic focus of where violence occurs, because Pittsburgh and Allegheny County are relatively very segregated communities compared to other major metropolitan areas. Next slide. And I'm a bit of a data geek person, so I could provide a lot more data if anyone is interested, but tried to give you some overview here. This is an interesting analysis that was done by the Department of Human Services, comparing data from 2018 to 2020, all aggregated, and again, comparing it to the aggregate of 2021 to 2023. You'll see here that the areas and hotspots where violence is most likely to occur is very well concentrated in the same communities. In fact, they're statistically significantly likely to happen in the same areas. That means that in general, our city is incredibly, incredibly safe. Because the violence is so locally focused in certain areas, while we might have a gun violence homicide rate that's about 16 times the national average, depending on the year you're looking at, if you focus the gun violence just in the areas that we're talking about here in circles, it's 62 times approximately the national average. 62 times for young people, mostly of color, living in those communities. So this is an epidemic in a public health proportion like almost anything else we've ever seen that requires attention. Next slide. It's important to note that by comparing this also, those same circles are imposed on this map, showing that these are communities in our region that are also disproportionately impacted by a number of systemic, standardized, and institutional racism practices that have occurred in the past, not by any malice, but looking at issues where there's estimated poverty, lack of education attainment, high levels of unemployment and joblessness, single parenting, lack of home ownership, lack of internet access, and high drug use in many of these communities. These are systemic issues that affect communities and have very little impact where individuals in those communities can change those outcomes. It's important to note that young people experiencing violence in our region with guns are about 10, young juveniles are about 11% of the victims in our region. The total number of homicides is averaged around 590 to 620 per year. Roughly 56% of victims are between the ages of 18 and 34, and 84% of homicide victims are male. 80% of those are Black, and despite the county only having a 13% Black population. And so the idea here is to understand that actually those who are also committing these gun violence crimes are also really mirror in the same neighborhood, same background, same social determinant factors that affect their, instability in housing are the same things that affect the victims as well. So there's an opportunity from a disease-specific model to really inform some direct intervention. Just to share with you specifically for those who live in the region, the gun violence is generally focused in areas of Homewood North, Homewood South, Bedford dwellings on the north side, Knoxville, Lincoln Larimer, and East Hills. So there's a real opportunity for change and a real a dispel to understand that, really our region is incredibly safe overall. Next slide, please. And we should really act. The impact of gun violence is profound. It not only strains educational, medical, and criminal justice systems. Exposure to gun violence is linked to higher risks of suicidal ideation and mental health and behavioral health, distress and depression outcomes. And surges in gun violence also impact the growth of new retail and businesses and home values in regions as well, not just in Allegheny County, but really around the country. So this persistent exposure to gun violence, even the exposure mentally of you see on the news and others and people feeling unsafe, has a persistent impact on people's disinvestment in their region and also abandonment on the work. And that's why we really felt as a foundation, we wanted to be able to get more involved to help people think about ways to mitigate the impact of exposure to violence on gun people, and then think about strategies for real action, not just talking about it, but real action. So the next slide. The 3 forum series that we're going to share with you were developed in complete partnership with a variety of community partner experts, as well as the United Way and the Institute of Politics, and really Lisa's leadership in holding this group together to think about ways that we could get out there, talk about these issues, make sure that the broader community is formed with the facts, and then think about strategies for moving forward. This work has given a critical nature to this threat so we can understand that we can work together. And it's an invitation to work together as a community, including you all, our donors and close partners, for the physical and safety of emotional well-being, particularly focused on children in our region. Next slide. And so the first forum was titled Invisible Wounds, Identifying and Addressing the Trauma that Gun Violence Inflicts on Children in Our Communities. The second was hosted by the Institute of Politics, which was more data, I think epidemiologic focused gun data, and also focused on policy outcomes. And the third was focused on mobilizing communities for action, looking at human services systems led by the United Way and their team with some really remarkable experts from the region. So let's jump in and talk about just a couple of slides on each of the sessions. Then we're going to talk a little bit just briefly about the recommendations and then some programs in the area that really mirror what we learned and what the priorities are for moving forward. And please don't hesitate to write your questions in the Q&A space so we can spend some time. I'm trying to zip through this part so we can talk more. Next slide, please. So the first series was done in as part of our book series in the region. I can't think of the name of it now, but where Jonathan Woodrow Cox, the author of Children Under Fire, came to speak. He had done a study and a series and published this book that talk about the American crisis of gun violence affecting young people in our communities. I strongly recommend that if you'd like a copy of the book, let us know, or to grab a copy of the book on your own. because it really highlights the experiences of a young child who was poor in their experiences with gun violence, and then a young girl who's exposed her to gun violence through a school shooting, and how that had a ripple effect, just not on that individual child, but their immediate family, their friends and family, the community, and really thousands of people more broadly. And so that's really what this session focused on, is how do we really protect and support young people from this impact. And we had a great panel, Father Abernathy from the CEO of Neighborhood Resilience Project, which I'll talk more about a little bit, Valerie Dixon, who has actually since passed away. So she was really an amazing leader and just amazing partner and friend who worked with the Center for Victims and helped drive a lot of their community support programs. Then Julius Boatwright, who runs an amazing organization called Steel Smiling that's actually couched within Neighborhood Allies here. And then Dr. Woodrow Cox was able to facilitate the session in a really beautiful way. Next slide. So wanted to pull out one of the quotes again. As Lisa mentioned, all of this information is on our website. If you were to Google Pittsburgh Foundation Gun Violence, you would find the webinar series or the session series. You can find videos for each one of these that are still available through YouTube, and then any secondary information, including the report itself. But Mr. Cox shared with us that gun violence victims include children who are in school where shooting occurs. He also shared really eloquently that it's not just that person who's a victim, but it's the children whose parent, sibling, or neighbor of the shooting victim too. The children are compelled to participate. In one area that he highlighted over and over again was actually the research that shows the potential negative impact of active school shooting drills in children, depending on developmental stage and social supports within their schools, that could actually be causing more trauma than real protection in terms of heightened fears of violence occurring in communities. This is a very complex issue that requires the heightened space of needing to create safety while also understanding from data the impact of exposure and preparation prevention services too. So wanted to share with you just a couple of notes that came from our speakers during that sort of fireside chat about a really difficult topic. Next slide. So Valerie Dixon shared that the experience, her real takeaways here were that losing her son to gun violence makes her want to help others impacted by gun violence. And her message to you and to us was a call to action on highlighting the importance of empowering people to support each other within and among their own communities. So creating spaces that people could live out this experience and support others in need, not be ashamed, but also really find ways to empower their action to change here as well. Julius Boatwright from Steel Smiling spoke about the importance of self-care. And interestingly, he also mentioned the importance of supporting each other, but his focus was very much on supporting adults and caregivers and teachers who were the first line of defense and protection for young people to make sure they were whole so they could be their best selves in this space. These are often people who are always giving, and like most nonprofit leaders, always giving of themselves in every way to make sure that they were their strongest selves and healthy mentally and physically to help care for young people who are exposed. And then Father Paul Abernathy advocated for the importance of implementing strategies to interrupt and reduce violence. And his take-home message was in a call to us that we've worked very closely and since on some regional initiatives, or to really intervene in a way that can also help coordinate the resources and services so you don't have people competing for funds or competing in the same areas, but really strategizing in ways that people as a community can create a warm, comforting web blanket to really help support young people so that anywhere they turn, there would be support services for them as they need it. Thank you. Next slide. It's really hard to boil all these sessions down to a few slides. So if you ever want to talk offline, can send you my cell phone and we can talk and think and strategize here with Lindsay and with our team at the foundation of ways that we can collectively work to help address and support this work. The second session was hosted at the Children's Museum and was hosted by the Institute of Politics, again together. This one was focused on saving our children from the epidemic of gun violence. Dr. Morris Szilagyi was our primary speaker, who was the incoming president at the time for the American Academy of Pediatrics, and Rosanna Smart, who was the coordinator at RAND of their Gun Policy in America initiative. And we had three incredible panelists that were local experts in this area as well. Dr. Jamil Bey, who at that time was running Urban Kind Industries, Reverend Tim Smith, but many of you may know from Center of Life in Hazelwood, and then Dr. Liz Miller, who was the department chair of adolescent medicine at Children's Hospital of University of Pittsburgh Medical Center, and had done amazing work. This forum focused again on data and policies to reduce fatalities, injuries, and trauma caused by gun violence. Next slide. These were all national experts as well as local experts that were involved and engaged at the national level. The forum focused on ways and strategies with a lot of discussion on how to help activate our region. And they focused on strategies that I'll share at the community level. But first, at the next slide, wanted to just share one of 3 or 4 policies that were highlighted, but one that was passed in 2022, which was the Rise from Trauma Act. It was a bipartisan bill. Chairman Durbin and Senator Capito supported these, and it expanded trauma-informed workforce services and supports in various settings, including healthcare workers, teachers, and first responders and community leaders. Now, it's important to note that some of what was shared is that the school shootings and the mass exposure to community and gun violence prompted these, but it's important to note that it's the same communities that we're talking about in Pittsburgh, Allegheny County, and in many cities around the country have been exposed to this kind of level and trauma of this public health epidemic for 30 or 40 years. So this couldn't come at a better time to think about ways to help promote better understanding about the impact of violence and think about ways to support communities. This project and this legislation created 2 new grant programs through HHS. One was the Communities in Providing Local Trauma and School Services, and the other was a hospital provision through HHS and federal funding for prevention services for those who are exposed to violence to intervene and disrupt upcoming violence as well. Along with this Rise from Trauma Act and some other ancillary support policies that emerged were legislation that promoted better and tougher background checks for buyers under the age of 21 and also up to 2025, expansion of red flag law policies, which are where a family member or a concerned community member or law enforcement can intervene in a case where a gun owner may not be emotionally competent or able to own and operate that firearm responsibly. That's not a permanent taking of the firearm, but in those cases where a spouse or law enforcement others have been notified. And then $15 million in funding was provided for mental health programs and school security updates in the regions. And the next slide. And then the last part of this series was a conversation where Tim Smith shared really beautifully that these kids are lost in many ways that he's seen through decades of work in this space, are lost to gun violence, had amazing potential, but had little opportunity and little access to resources and education. So thinking about ways to help support and buffer and protect them from this exposure, we need to understand why every human being needs to have the sense of belonging and security, and everyone deserves that. Young people in Hazelwood, young people in Homewood, young people in Fox Chapel, young people in Sewickley. These are young people that are just affected by the environment and world around them. And Dr. Bay wanted to share with you some really interesting findings that he shared from research done here in Allegheny County, but also around the country, where he said good results can come from really unexpected places. He talked about a project called Trust the Trees, in which he organized community members to work with Tree Pittsburgh to plant trees in the region. So these weren't corporate people coming and planting trees in their community, but people in the community getting trees from Tree Pittsburgh, planting them, and creating convening spaces that provided shade, that provided convening, and also a space where people could watch things grow. And that act alone has shown to have a significant impact on gun violence exposure in many communities. And we want to understand that better and always think creatively about next steps. Next slide. We're making good time, everyone, so I'm going to keep some good time for questions at the end. The third forum was also remarkable. It was hosted here at the PNC building, I believe. PNC dedicated and offered the space. It was again organized by the United Way with Bobby Watt-Gear, their CEO and president. And it involved a really amazing panel of Sean Garrett from the United Way of Greater Chicago, Josh Flightman from Ceasefire PA, Anthony Smith, who was the executive director of Cities United. Our mayor, Ed Gainey, was there as well. And it was facilitated by Anna Hollis, who's the executive director of Amachi Pittsburgh, which is a really remarkable group that works primarily with young people whose parents are incarcerated to prevent that cycle. And next slide. As you can see from the background in this picture, they talked very much in this session about the need to not think and react without a plan. How do we work together to be strategic and opportunistic about what are the capacities we have? How do we think carefully about the gaps that we have and make sure not to focus just on those, but to have a plan, to put it in paper, to work together, to continue to deepen our partnerships in these spaces. And how do we work collectively and responsibly to create opportunities for economic development, educational opportunity, recreation, health, and opportunity to live safely. If you think back to that diagram of neighborhood level risk around social drivers of health and public health exposures that are really beyond people's control, this is what this area got to. It started looking at the root causes for these issues, and let's stop looking at gun violence as the outcome only. It's really just the symptom of those systemic disparities that exist at a deeper level. Next slide. And this, whoops, is there forms? Is there one before this? Oh, oh yeah, I'm sorry, I missed this one, my bad. Is that they also talked a lot about who can and should be involved in this work. And it was a call to action across all of our areas of practice. And I think as we've talked a lot about Lisa recently, and really with Lisa's leadership, is also that let's think strategically about who should do what activities based on the muscle memory we have, the kind of skills and capacity we have, and not everybody doing each other's work. So this session spoke a lot about and gave examples from the United Way, from Cities United and the mayor's office, but even Ceasefire PA around areas how the private sector can be involved, the philanthropic sector around seeding new projects and providing proof of concept opportunities, the nonprofit sector around being responsive, but also helping to develop a space where their expertise can inform the funding and deployment initiatives, working closely with government and also law enforcement as a partner and not just a response agency, but thinking strategically about change. Academia to help provide an opportunity for bringing new data under the new legislation where we're now able to, under the new National Office of Gun Violence that was created to be able to do research to help inform this information with real practice. And then along with the nonprofit sector, also community organizations that are informal. There's an incredible network of churches and community leaders. And if you think back to your childhood and others, who are the people that in a Pittsburgh term were just nebby and involved? And those are real experts in this space. And from my, almost 25 years of gun violence prevention work and research, young people in their communities often point to them as Betty or Miss Barbara, who's always on the corner looking as someone that they really trust and need. And we should, as external partners, always be building on that internal capacity of economically underserved, but really amazing, strong communities as well. So we're about 5 minutes left, everyone. So the next slide, I'm providing with you just a subset. Oh, one more, please. Sorry, Katie. An example of some of the series recommendations. There are actually 6 more in addition, but these are the top level ones that emerged. The first one is providing trauma and behavioral supports and resources for youth and communities. Next one. And this is also for that other recommendation around supporting teachers and first-line family members and other providers in spaces that have interaction with young people. I want to let you know that these recommendations were vetted with all of our community panelists, as well as a subset of participants from a number of our nonprofit partners to just check our assumptions, understand if we're thinking about making the right recommendations, but also making sure our panelists agree. Number 3, please, Katie. Expand and tailor job training and counseling programs, which we've been a lot through our economic development and mobility programs here at the foundation, and many of which you as our donor support services help support and complement the foundation's investment in these spaces. The 4th is to nurture and facilitate the coordination of violence prevention programs. And I'll just be honest to tell you, we're neck deep in this one right now with a county level initiative. I serve as part of an executive leadership team helping to coordinate about 25 programs that are funded to help make sure they're not applying to the same funding, they're not competing in different ways. And also it's some hard conversations around where some groups should be involved and some shouldn't, but how do we make sure to support the ecosystem in a way that doesn't cause harm? We want to make sure to do that. And then 5th is to open and properly support recreation centers. This has been a big push by the Gainey administration, is how do we use centers that aren't open, keep them open and after hours, use the spaces that we have in communities that kids are aware of and trust to make those the most effective spaces where kids can feel safe, learn and thrive, and then bring services and supports to those areas, not just for young people, but for their community families as well. Keep writing your questions down if you have more or anything you're struck by that's new, or if there's anything you think doesn't really resonate with you, we'd love to talk about that more. So I've framed the outcomes in terms of prevention programs using a public health model. The first is around primary prevention. If you go to the next slide, please, Katie. So it's framed in a way, this is an evidence-based practice model to think about areas of prevention. The primary prevention are often thought of as universal prevention opportunities that is designed to prevent by reducing risk factors and promoting healthy development in the universal case. These might be teaching social skills to resolve conflicts for young people, limiting access to firearms, and strengthening firearm safety features. The second is secondary prevention, which aims to reduce the effects of gun violence by helping individuals who are already at increased risk. This might be conflict mediation services, mentoring programs, other areas where a young person might have been exposed to violence, showing signs of being impacted by trauma, and how to do intervention in that way. And then tertiary prevention aims to help individuals recover from violence by addressing trauma and injuries. These might look more like social support programs, community healing services like support groups, medical support groups, and mental health services, and also rehabilitation and support services. It's important, though, to think about this trajectory of primary, secondary, and tertiary not as linear, but this really folds and wraps around, because nothing in our life is an Etch-a-Sketch that ends just, because we decided to start an intervention. Most important here is that we have to listen and learn from the community as our experts to understand what they're already doing, how do we help support that, and build on the strengths that exist there. I did pull together a number of examples for you, but I have many more. As my colleagues here at the foundation will say, I have a hard time limiting my information at times. So I've tried to be pretty concise here, but we're happy to provide more with Lindsay's team and our broader support services through the entire foundation to help you learn more. But the next slide is a number of examples of organizations we have many, many years of working with that are doing evidence-based, impactful work on changing the lives of young people in our region. The first is Brothers and Sisters Emerging, which is located in Garfield. It's a program based on youth football and cheerleading program, which if anyone's from Pittsburgh, you know that our football leagues, youth football leagues are a pretty big deal. But Bob Jones in this program, we've worked for many, many years on our youth and justice and intervention programs in Garfield, but around the region. They serve about 45 to 50 young people a year. It's also this really interesting cheerleading program, but they've evolved into a mentoring program, building on positive relationships and engaging young people in job development opportunities as well. A really unique program I wanted to highlight is Youth Opportunities Development that is in Clairton, PA. The individual who runs this, Brandon Zients, is a close partner of the foundation, came in through our Small and Mighty program, and has grown a program in an area that is really deplete, I think, of overall broader human and social support services, but an incredibly rich and deep community of relationships. Here in Clairton, he works really dedicated to ensuring peaceful, prosperous communities through mentoring, education, and empowerment. There's a lot of life skills development in this program. I've been there many times myself, and it's a lot of experiential work where he will work on a monthly or 6-week basis and say, what's the community initiative they want to be involved with? And last year, they really wanted to help young people in the community, their peers, but really make sure that they were warm in the winter. And they collected something like 300 jackets and snow pants and boots and things like that for kids in the community, at the same time deepening their relationship and their own accountability to come to this program and be honest and supportive of each other, but also with Brandon's dedication and working with other groups closely in Gwen's Girls that has a location in Clairton, but then also around the region, of how to help them see and think of a horizon line future that isn't so impacted by exposure to risk factors that do cause and impact gun violence. And then Gwen's Girls is an incredible organization, primarily supporting the self-sufficiency of young adults, but really primarily young girls, supporting emotional, physical, and spiritual development based on Commander Gwendolyn J. Elliott, who helped start this program 30 years ago. Her daughter, Dr. Kathy Elliott, now runs the program now, which has been central to our human services response and intervention services in the region. But they've just had an incredible impact on young women, upwards of 100 girls per year. Next slide. At the secondary prevention level, wanted to share with you 2 really unique programs. I do want to note here, though, that Allegheny County has supported a $5 million initiative over 5 years, working closely with the Neighborhood Resilience Project to coordinate a regional response to gun violence called the Community Violence Reduction Initiative, CVRI. So I'm sharing with you a couple of organizations that are working in collaboration there, but really do have unique needs and are really directly engaging young people as experts and leaders in change in their communities. One is the Safe Passage program from Operation Better Block. Tylee Thompson is the manager and director of this program, who has decades of experience working in this space and has his own lived experience with exposure to violence in the justice system. And they've done an amazing job. I had a chance to meet with them about 6 weeks ago with about 40 youth and 7 or 8 adult mentors that work in schools, PPS, and they have implemented training and movement within these young people. So they've learned formal conflict mediation skills, counseling support, and this is students mentoring other students in this work. And it was remarkable to hear how many times the young people, as me as an outsider coming to learn more, were saying, I can't get through the hall without hearing about a beef or a fight or something that's going to happen. So they are actively intervening every day in their own schools, but then when something does occur, to provide supports that are so deeply needed. And then the South Pittsburgh Coalition for Peace over here in the Hilltop area funds a number of programs in a youth intervention and gang violence intervention program, where if they have 7 outreach workers that work. If there is violence in the community, they quickly go to that space, understand who is involved. They have the relationships in the community to do prevention, and then they intervene and prevent that violence. They're working closely in Arlington Heights, and they have a really strong regional youth basketball program in Mount Oliver, but they also travel. And so you'll see a theme around sports, but often meeting young people where they are. And then the last example I wanted to provide for you is on the tertiary prevention area, is around the work of the Neighborhood Resilience Project, again, NRP, that is managing some of our region's work, but they also have a really unique trauma response program where they go in a van, they deploy people as volunteers that are really well-trained to, when there's a shooting or gun violence or other intimate partner or domestic violence incidents, they run to that scene. They provide emotional and physical support for individuals where needed, and they help people understand the signs and symptoms of trauma, mental health, and physical health care, and make sure that they're connected to services. So really an evidence-based practice that's grown. One of our favorite programs in the region is Infinite Lifestyle Solutions, that is run by the director, Cecilia Ware, who's a trauma-trained, trauma-certified nurse practitioner, who, because her son was not killed but shot, changed from being a practicing nurse to start a program that is both fun and engaging. They do incredible arts and cooking together, but they also do restorative practices and art therapy and trauma-certified healing circles with young people so that they can really reach their full potential and not just skip over or try to forget this exposure, but use this exposure as a growing point for real long-term income. And then, real long-term growth, excuse me. And then Reimagine Entries are kind of on the other side of the spectrum, run by Richard Garland in our region with a lot of regional philanthropic support, but is really tapping into a critical, important area of how do we help returning citizens who have been who've experienced the justice system, who are sometimes at 8 to 15 times the rate of experiencing gun violence and homicide upon coming back from incarceration, working with these individuals before they're released from incarceration, but then making sure when they come back, they have one-on-one trauma-informed services, coaching, professional and social mental skills, support, and an ongoing coach that works with them over time to help them reintegrate back into society and thrive, developing really good working skills to grow. And I think that is my last slide. And I hit almost at 15 minutes left. I want to leave us a good bit of time for questions. If I spoke too quickly and I skipped over something, let me know. I'm happy to get back to that for you. I can't tell you what a privilege it is to meet with you and share this information. Thank you, Lindsay and Lisa and our team here. And I hope this isn't the last of our discussions on this topic, and look forward to working more.
Thanks,
Lindsay,
Michael.
back to you.
Lots of really interesting information and great organizations that you featured at the end. But of course, if you're inclined to support, please do so, or talk with your donor services officer, Michael, more about. Just one question so far. So I encourage folks to put questions in the chat. The first is, so what's next for the foundation in this work, Michael, in your role?
Yeah, so we are actively working with the United Way, a design team of community partners, to reconvene the group to look at the recommendations and findings, but specifically in 2 areas to discuss. One is providing trauma support for those 2 recommendations around support for young people. and teachers and family members, and what would that look like? There's a particular focus on working with caregivers, particularly young moms who've lost young people to gun violence and people in their family. And Tim Smith in the Center of Life has been working in that space. And so we're looking to really build on those actions and our space at the foundation of really being a convener and an actor in this area. And then the other is being involved in the current activities where we're involved with the Community Violence and Reduction Initiative, and working closely with the Department of Human Services, and really providing a responsive support anywhere that's needed. We also do support other, all the programs that we've mentioned here are programs that the Pittsburgh Foundation has provided, except maybe, I don't know about the reentry. I think reentry was on this last round, but the others are long-term partners in this space. So we're using this data and information to also guide our grant making, and we hope that you'll consider that as well. So we've done the due diligence. We're really thinking carefully about where these dollars are best spent, and we are really accountable to helping to support communities.
Awesome. Thank you. And another question from a very beloved donor of ours. Wonderful presentation and great data, especially info about primary prevention. But much of what you have shared today related to after the fact support of the communities, teachers, schools, etc. But as long as the upstream issues of concentrated areas of poverty and the unlimited supply of firearms, why is there hope for real change? And then I'm going to keep going, and then you can come back to that. It is very frustrating that despite repeat gun-related tragedies, school shootings, and our kids being killed, there seems to be no political will, federally or in Harrisburg, to do anything meaningful. Now that all three branches of our federal government are controlled by a party that seems especially deaf to gun control measures, is there any reason to have any realistic hope for change legislatively?
Yeah, I mean, I agree. I think we're in a unique space and time where there are a lot of boulders in our way, more this week than a few weeks ago, maybe when it comes to this work. I'd say that we're creative and passionate humans, and that just provides us an opportunity to develop the right ladder, the right shovel, or the right way to get around those boulders in a way that's really meaningful. I will say that the most impactful data outcome, what's a good way to describe this? I'm going to ask you all to say, has everyone heard of the DARE program? You can raise your hand. I can't see any of you, but I'm sure we've all heard of the DARE program. The DARE program is one of the most evaluated drug use interventions in the country, millions and millions of dollars, and it never seems to work. Although it's heartfelt in many ways because it feels like it should work. The data has shown it has worked in a number of cases when that police officer or counselor has developed a close, engaged relationship with those young people. And they feel accountable to that. It's not the data around the drugs, because it's not necessarily developmentally appropriate, but it's the notion that this person cares about them, needs them, and supports them. That's the first level of universal intervention, is recognizing that all kids in communities are our communities, and how do we support the kind of structure that people can thrive? There's no question for, what was provided is we are at a time where a lot of those threats and supports around well-being are being challenged. There's no question. And that means we need to work and think more creatively, more efficiently, and more responsively. And, much like we could have thrown our hands up in the air, during COVID, I would say we as a foundation and many partners in the region did an amazing job of changing our rules, changing our collaborations. And in many ways, I always say this, Lisa, I feel like we were our most effective during COVID because we were urgently working and responding. And I'd say, and this is that case where we should be doing that as well. The universal prevention and the primary prevention services, yes, there are a lot of issues that we could work on and still support Ceasefire, which is one of our grantees that we've worked and supported with in the past. We need to keep moving for that. That isn't about removing necessarily guns from the streets and others, although I think that might be important in some ways. But we should be promoting for safe technology where there's hand recognition that ring or that fingerprint is the only thing that activate that gun. 30 years ago, that was like Star Trek technology. Today, that's just standard technology. That could really be done today. Gun locks, not a big deal, really easy. Safe storage of guns, really important. If your gun is stolen, it should be reported. There is just no question. So these are things that we can advocate for, and research that Jonathan Woodrow Cox shared is that legal gun owners actually advocate for many of these same policies the same way. So that's a really important space for common ground building where we can work with gun owners and communities to think about legislative practices that we can work on, but it also gets to the grassroots level of how to work within our communities to support people who are trying to thrive. That sounded a little bit philanthropy, but I think there's lots of opportunity that we can still continue to grow. In the mid-90s, I mean, people threw their hands up when there were tens of thousands of shootings and homicides in our country, and we worked through that. So I think we have a challenge and an opportunity to do better together. Thank you all for this opportunity. I would really love to be in touch again through your DSR, your donor services officer, and with Lindsay's team. In any way we as a foundation can help advance your work. I would say, you know, philanthropic support is one area, but your time and energy and expertise are things that many of these programs and communities would really love to engage in as well. So there's lots of work to be done together, and really excited to do that with you.
Thanks, everybody, for joining us. If there are any further questions, don't hesitate to reach out to us. Enjoy the rest of your Thursday. Thank you.
Thank you.